Hey, Bree and Josh, it's Dr. Cullen, Terry Cullen. Thank you so much for your time. Dustin, thanks for sharing your story. I really loved it. It did make me laugh. I was smiling. Next, we're going to go on to policy, which, you know, we talk about data to action. Data to policy is also really critical. So another crucial piece to autism acceptance is policy at the local, state, federal level to advance the rights, increase access and equity for all people with disabilities. To introduce this topic and to talk about it, we're really privileged to have two people that are at the forefront of disability policy in the state of Arizona. The first is Erica McFadden, who serves as the Executive Director of the Arizona Developmental Disabilities Planning Council, and Will Humble. Will is the Executive Director for the Arizona Public Health Association with more than 35 years in public health, including the former Director of the Arizona Department of Health Services. And Will has become my friend and mentor over the last year, and I've been so grateful to have that opportunity to interact with him. Thank you both for joining us today. I think Will is going to kick it off, and then Erica is going to go. So thank you very much.
Thanks, Dr. Cullen. Thanks for the opportunity, and welcome everybody this afternoon. Hopefully we're at the beginning of a monsoon. It felt a little different when I went and got the paper this morning. I could smell the humidity for the first time. So that's one of the things I kind of like about Arizona, is that beginning of the monsoon season. You're always hopeful at the beginning, often disappointed at the end. Thanks again for allowing me to talk about one of the things that's most dear to my heart, which is policy development to help persons with developmental and intellectual disabilities. I want to kick off. Erica's going to be doing most of the heavy lifting during this segment, but I want to kick off by introducing, for those of you that haven't heard of the Arizona Developmental Disabilities Planning Council, who that organization is and what role it can play in policy development and implementing new and innovative programs to help persons with developmental and intellectual disabilities, including, of course, people on the autism spectrum. So the Arizona Developmental Disabilities Planning Council was actually reformed in 2009. And it's an organization that really is geared with two kind of core elements in mind. One is to provide a forum for self-advocacy for people with developmental and intellectual disabilities, their family members, and just people that are interested in helping our population. And others, other areas have to do with they actually get a fair amount of grant funding from the federal government, and they're able to put forward grants towards programs that are innovative and promising, that help produce outcomes that are good for persons with developmental and intellectual disabilities. And a third element of that policy work that the council does, which I think I really appreciate, is the fact that they don't wing it. They actually go out and collect data. They analyze data, and they use that data to help, or at least try to get that data into the hands of policymakers, whether that's at the city level with city councils, whether it's at the county level with county supervisors, in state government, and importantly, so they can inform administrative advocacy. So that would be helping our state Medicaid agency, known as Access, the DDD division of Arizona Department of Economic Security, the state health department, even housing. So they do a lot of data collection and analysis to help inform that policy too. So if you haven't visited their website or learned more about what the Developmental Disability Planning Council does, I invite you to just Google it. You'll find it right away. ADDPC, right? Erica.gov
Not easy.
And
You got that.
I was fortunate to be able to serve on the Developmental Disabilities Planning Council for several years. Everyone on the council they're on there for a reason. And one of my kids, he's 28 now, maybe he's 27. He's 28, is Luke, and he has Down syndrome. And so that's become part of my world. And but I also happened to be this director of the state health department during that era too. And so I could do a couple of different things on the council. So I don't want to take too much more time because Erica has a lot of interesting stuff to talk about. So Erica McFadden, who I'm introducing right now, was, when I was on the Developmental Disabilities Planning Council, she was one of the persons that received some of the grant money. She was at ASU, right? Not U of A,
Yep.
ASU. And she received some of the grant money that the council has to do in-depth analyses to help inform policy. So for example, one of the projects Erica worked on was the acute need for better coverage for dental for persons with developmental and intellectual disabilities in Altex, because for many years there was no dental services at all for persons. And so Erica did a deep dive and figured out the actual human toll that was taking, that policy that there was no dental services for persons with disabilities. And we translated that. It took years. It took a few years, but we were able to translate her data into actual policy. And now there's it's modest, but at least there is a modest benefit so that people with developmental and intellectual disabilities in the Altex and Medicaid program can get some, at least, dental work to happen. So that's just an example of doing good data collection and analysis, and then translating that into actual policy that helps people. And that's one of the core missions of the DDPC. So Erica is going to talk about, which is really exciting timing for this meeting today, because the council has done, and Erica will talk more about it, a deep dive into getting actual information from persons with developmental and intellectual disabilities, including people on the autism spectrum, to find out what they think the highest needs are in Arizona in terms of policy. And so, Erica, would you like to open up your slides, and we'll talk a little bit about what you found?
Yes. Sorry, I was experimenting earlier because I always screw this up. So can you see my slides, Will?
And yeah, we could see it. And
Okay.
Now, Erica is the executive director for the council. So she no longer works for ASU, or maybe you're adjunct, you probably are. But she's the executive director for the council. So she's the lead person for the council these days.
That's right. Thank you, Will, for that great introduction. I appreciate it. I'm not even paying him to do that. So I appreciate that, Will. So let me get into the meat of why we're here today when it comes to policy. One of the things that we're always missing when it comes to planning at an organizational level is, what do our members with developmental disabilities or autism think? And so we often miss the boat. We'll ask families or providers, but often we're not able to get to the person themselves to get what they think are the priorities. So last year, we did a really interesting experiment where we put out a survey in plain language and easy to read, easy to write sentences, with little smileys, and they had to pick which ones. It was very accessible. We had alternative formats, and we worked with multiple different organizations when it came to disseminating the survey. So we had about 7 different organizations helping us get it out. So what ended up happening was we got 247 people who responded, which is really good. Nationally, we had others do this as well, and they only had, a fraction of what we had back. And if you look on this particular slide, here's a breakdown of who did the survey. Most of them, not surprisingly, were from Maricopa County. 15% were in Pima, and 20% overall were Southern Arizona. Majority were white, 62%. We had about 18 Hispanic, 7% Black, And we had about 10% reporting more than one race. 49% were female, 11%, because I get this question all the time, did you have any youth fill this out? 11% reported that they were under 18 years old. And they had a choice to check any box that they represented and what their disability was. 48% reported having a cognitive disability, 35% in emotional or mental health, 32% physical, 9% deaf or hard of hearing, and 8% blind, low vision. Do you want me to go on, Will?
No, let's press ahead because let's get to the results.
Yeah. Okay, so here's the format. Bless you. Here's the format of how we ask the survey. I don't want this, I don't care about this, I want this, or I really want this. And they had 25 issues that they had to report that they really wanted and they wanted. And so here's what the results were. 66% said they really wanted anyone who gives me medical care to talk with me in a way that I can understand, which includes doctors, nurses, dentists, and therapists. So we all know this plain language is a problem. Understanding what your doctor says is a problem. And so that was the overwhelming majority of responses. 65% reported transportation, of course, 63% reported a job where I'm respected and valued. And then following that was more training and rules for police on treating people with disabilities correctly. And one of the top 5 was more help in stopping others from hurting me or ignoring my needs. And this includes around bullying and harassment. So we did a separate breakout specifically for you all today for this conference. And as a proxy for autism, because we didn't necessarily ask them if they had autism when they filled this out. You know, but several of them, we did filter participants who said other, and they put autism in the box, or we broke it out by those who had disabilities before the age of 22. And they also reported, I have a disability that affects my mental health or emotions. And so when we did that, 71 participants fell in this category, and 13 of them were under age 18. But it changed a little bit because majority then reported more training and rules for police on treating people with disabilities correctly, followed by a mental health provider who understands my disability, and then the medical, plain language medical care with your doctor, then the job, and then the help in stopping others from hurting me or ignoring my needs. So there was a little bit of a difference, Will, by who was filling this out. Those who typically found the proxy for behavioral health, emotional, or autism had more policing was on top of their list.
Yeah, so Erica, I've been doing this now for a long time, and 2 of the areas that on every survey that I've ever seen that show up are job train, more opportunities to have jobs in the community, and transportation, especially transportation. I've always seen transportation near the top of the list. And that might be in part because of the fact that we're in Arizona, where there's just the transportation limitations are so intense. But this is the first time I've seen results come out like this. And in part, it might be that we didn't ask this question in previous surveys around the interaction between law enforcement and persons with disabilities, and in this case, autism, and also doctors or healthcare providers not understanding, not having the training, or at least not using that training to help them be more effective at communicating and talking and speaking with people, and in particular this population. So did you add these new questions about law enforcement? Is this a new thing, or is this something that you see as like popped up that you've always asked it, but now it's become more acute?
So to take a step back, we got the top issues, the 25 we listed. We pulled nationally from every other state, and state councils who were reporting issues that they were working on in their states. And so policing was an issue that some states were working on. So no, we've never specifically asked that question before. We actually pulled it from our sister organizations when we pulled out the priorities. But for us, it was shocking to see that police was in the top of the list no matter if you were in the general group broadly or if you were specifically pulled out by this category. And it just goes to show how important it is to make sure that you leave options for people to fill out, if they have other issues. So we did that on the survey, and they were coming up with having a provider who understands my needs and things like that. And always keeping our ear to the ground and our minds open of what other issues could pop up. I can tell you the policing thing, we tried to get a law passed a couple years ago to get, required training for police to work with our youth, that they interact with our youth, to ensure that they all have training in autism and other disabilities. But that bill got pulled a couple years ago because they thought that Arizona Post, which is the training site for our police across the state, they thought that they would be revamping their training, and so they can include more disability specific training like this. So they have tried to beef it up a little bit, but it's still not to the level that it needs to be. A lot of advocates are still saying that it changes from one jurisdiction to another. And so we're trying to work with different police departments to be able to ensure they know about state, as well as they get some kind of training for their officers so that our people are safe when there's an interaction with law enforcement.
So this is an example of data collection and doing the survey, identifying a problem, and then over the next 18 months to 2 years, working on approaches to help improve this. And that might, through the council, right, be either through a grant that a jurisdiction applies for, let's say the city of Phoenix or some other entity to do something creative with dispatch, or it could be resurrecting the bill that you talked about, which is a longer term solution to get better training for law enforcement. But my experience has been sometimes you're more successful if you're more targeted. And if you do training of dispatchers who then have a cohort of law enforcement people that have more in-depth training, they can respond to calls like that. And you've got, and I know a lot of fire departments are doing things that way, where dispatch understands that there's a special need on that call, and then they're able to select those firehouses, for example, that have the more in-depth training and more specific staff that are able to better work on, or they're a better person to respond. So that's another way of looking at it. I know you have some additional results, and we only have a few minutes left, so let's move ahead.
It's the last slide, Will. It's basically what you were suggesting. Where do we go from here? With those pilot projects, policies that need to be passed. You had mentioned some ideas to improve response with first responders. And one of the things that we funded is this past year is the ARC, the National ARC, the Criminal Justice Initiative. They are going to be running our group that does sexual violence and intellectual and developmental disabilities response, our collaborative, and they're going to ensure that we include more people from law enforcement, prosecutors, public defenders, to ensure that our kids and our adults that have different types of disabilities are adequately represented and that people are trained. And so they're pulling in different people to be able to ensure that that's happening. And as you see here, we have other books too that have to do with what we found in the survey. I mean, I know that DDD has integrated behavioral health, and their plans. However, we're still hearing issues with our people not being able to get fully trained counselors that understand autism and other disabilities when they're working with their behavioral health people. So we're trying to expand that trauma from counselor list of people who are educated and trained and working with intellectual disabilities or autism. And then Will, you and I both know when we were dealing with vaccines, trying to get vaccine priorities for our people, part of the benefit of all that work we did, there were so many community organizations that were involved in that effort. And we were able to put together how to create an accessible vaccine site list to be able to pass out. It was presented at the governor's office, and now we're using it to work with medical providers now, so that if they're working with somebody who has autism or other types of disabilities, they know different types of accommodations that can be provided to somebody, not just for the COVID vaccine, but if they're having to give them a shot or if they're having to do something, how to communicate. And so we've put together that list. Now we're working now with CDC funding to be able to expand a toolkit for providers and families and individuals to be able to have those better relationships with their doctors. And then one last thing I want to mention, because we did talk about federal policy. You know, we're going to be getting a windfall of money into from the American Rescue Plan. It's anywhere between $250 million to $1 billion pumped into our home and community-based services system. Currently, Access, our Medicaid provider, is writing up a plan for how they would like to spend that money. This is the time when we can innovate, to try new things. We know that our provider system is having historically just shortages of finding workers. And so looking at maybe potentially looking at credentialing, you know, different types of a credentialing program that people might get paid more with more training, maybe making some of the benefits that were temporary, like paid parents for minor caregivers, making that permanent. These are just things that they're looking at. I don't know what they're ultimately going to be doing. Mid-July is when the deadline is to submit to the feds on what plan can be accepted, but they are looking at even employment on how they could credential, you know, employment providers and services so that they're trained on how to work with our kids that might have autism and how to get them into customized integrated employment. So stay tuned. Access will be releasing hopefully a draft to see what they're going to do, and hopefully there'll be something that addresses some of the issues that we're dealing with today when it comes to policy.
Thanks, Erica. Now, I think we're already out of time, but do we have time? Is there a question or two in the chat box? Or I don't want to take away from the next person's time, though.
Oh, I think,
Mr. Hummel, we do have a question in the chat, if you'd be willing to address to you and Erica. It says, can you please speak on how you're partnering with existing partners in meetings like in meeting these training needs, like the sister agencies like DDD, but also the managed care organizations that partner in trainings like CIT?
Yes, I can. Thank you, Colleen. So there is a group called the Arizona Safety Coalition, and they meet every few months. And it includes the managed care organizations, DDD, ADDPC, a couple of law enforcement agencies. And that group is looking at, you know, how to expand the number of trained organizations throughout the state, as well as, you know, getting together a training list and putting out to law enforcement. And so the whole goal of that group is to be able to expand trainings and to get more trained organizations. And so, and Colleen, I haven't heard, I think that's it, right? This is, okay, yeah. So I think that's the group that she's talking about is that coalition. And if you're interested in knowing about it, just email me. I can put my email in the chat box and I can send you information on how to join.
And I just want to plug for everybody the planning council. They've got a very professional staff. They are an independent entity, and that's one of the real values of that organization is that while they're sort of part of state government, they don't report to the governor's office or a state agency, and so they can really act in an objective and independent way for families and self-advocates and persons in the community. And so they're a terrific tool for translating needs like what we just talked about today into actual policies, and not just limited to what we talked about today, but it's a really critical and I think important resource that we have. And we're very fortunate to have Erica as leading the team because she's a true professional and she really cares. It's not just a job for her.
Oh, thanks, Will. You care too. I think we all care. That's why you guys are here today, huh? So, but thank you, Will. And just email me or Will if you have any questions or thoughts or want to get connected. We really are kind of and everything. Most of the policies that we were supporting in the legislature this year, everything got, sidelined, nothing passed. So there's really not much to report on state policy wise.
But
But
remember, but I do want to say one last thing before we go, which is we are in a very unique period of time, really for the next 2 to 3 years, because of the amount of money that's coming in through the American Rescue Plan Act. It's unprecedented, and it's coming to state agencies like a Department of Economic Security and Access. And if we're thankful we have like the DDPC to help inform the decisions that those agencies make, because for so many years, there just isn't the kind of financial resources to really make a big difference. But that is, over the next 2 to 3 years, has really going to change because of the Rescue Plan Act. And it's super important for all of us to hold our executive branch people accountable. So the governor's office and the state agencies, so that they make sure that they're including persons with disabilities in the planning work for how that money gets spent, like Erica mentioned, around the home and community-based services. And as everybody knows, there's this terrible lack of providers that are available, and the turnovers with the support coordinator because of the lack of continuity and a career pathway for them, two of which those are two huge problems that have been around forever. And with changes to HB for the home and community-based services and that money, perhaps we can make a long-term difference in that, so that it's easier to find support persons, whether that's respite or habilitation or other kinds of supports, because it's been a problem for a long time and it's not getting any better. So with that, I think we're done, right, Erica?
Yep, thank you all.
Okay, somebody give us the hook.
Thank you so much, Will. This is, consider this the hook.